Let's talk about central cyanosis. Right. So central cyanosis occurs due to either imperfect oxygenation of blood in the lung or admixture of venous and arterial blood. Right. So we're talking about a disorder in the oxygenation, so in the lungs. Right. So that's number one. Or number two is if there is that shunting of blood or atrioventricular septal defects, right, around those, or PDA, etc., as you are going to see, right. So central cyanosis is evident when the patient's saturation falls to below 80 to 85%. That's where you will see central cyanosis. And the best site to see central cyanosis is the tongue, right. Remember I said in peripheral cyanosis, the tongue is spared. Right, so the causes of central cyanosis can be classified as respiratory, cardiovascular, and others. So in respiratory, as I just mentioned, there is a defect in oxygenation of blood in the lungs. Right, so the conditions that can cause central cyanosis are chronic obstructive pulmonary disease, COPD, severe pneumonia, tension pneumothorax, massive lung collapse, acute severe bronchial asthma, massive pulmonary embolism, pulmonary infarction, diffuse parenchymal lung disease, also known as interstitial lung disease or interstitial lung fibrosis, acute or adult respiratory distress syndrome, and respiratory failure due to any cause. These are the respiratory causes of central cyanosis. On the cardiovascular now, the cyanotic congenital heart diseases like tetralogy of Fallot, transposition of great vessels. There is a phenomenon, it's called the shunt reversal. That in that case, there will be this admixture of blood, and therefore that reversal is called Eisenmenger syndrome. Eisenmenger syndrome, and the causes are atrial septal defect, ventricular septal defect, patent ductus arteriosus. It can also occur in acute left ventricular failure, and these are the cardiovascular causes of central cyanosis. The other you need to know are just two. I have two here. There is high altitude. This one is physiological, right? Those mountain climbers. And in polycythemia, as I mentioned in the introductory video number 1. If you haven't watched that, just check on the playlist in the video description, and you watch all the videos concerning cyanosis. And that is central cyanosis. We see the causes, respiratory, cardiovascular, and others. Thank you.